I want to show you how to use a foam roller against the wall to relieve yourself of upper back, neck, and shoulder pain. And most people that have these things don't use them in all the different ways that you can. So I just kind of created this myself, but here you go. So say you've got tension in your trapezius muscles and your neck and your upper back. What you do is you get up against the wall, get the foam roller at about mid-back and pin it against the wall with your body, and then you walk out, and as you walk out, the foam roller gets higher. Let me reposition it a little bit. The foam roller gets higher, so now I get my arms and shoulders really nice and relaxed. I hold one wrist or one hand with the other, and then what I do is I roll up and down, and I can really get on these muscles really nicely. Now if you just leave your body kind of flat against it, yeah, it feels good. You can feel some hot spots. I can feel some hot spots in my upper back there near my shoulder blade. But now if I turn my body a little bit and I get in an angle and get more of my weight just on the left side, now I can really feel some tight muscles in there that I can work. And what you want to do is you want to just, I don't know, work these muscles for about 30 seconds, a minute, just on one side. Tilt your body back and forth to find the right angle. I'm going to grab my left arm since I'm doing my right arm, my left side, and keep this arm totally relaxed. I can just sit on it. The more that I walk my feet out, the more of my weight pushes into this thing, and it feels really good. I can feel that actually radiating up into my neck, almost kind of behind my ear into my jaw right here. When you hit a spot like that, that's a trigger point. You want to find that. It should always hurt good. It shouldn't just hurt. If it just hurts, you're doing it too hard, you're doing it wrong, and you just need to kind of straighten yourself out a little bit like this, because now as I stand straight up, less of my weight is pushing into it, so it doesn't hurt as much. So I can really work these muscles right in here, and I've got some serious tightness there right in my shoulder blade, on my shoulder blade, and I'm just going to work all these muscles. I can come up a little higher, and then I can turn my body and I can work my traps a little bit more. I can kind of get up onto my neck a little bit, right? You got to be careful, not too hard, right? Because you're getting into the cervical spine, the neck area, and it's a little bit more fragile. There's smaller muscles, and so they're closer to the bone, and so it starts to hurt a little bit more. So notice how I've gotten my leg closer to the wall, and now I'm modulating my weight so that I'm not pushing as hard, and I'm getting that therapeutic effect, right? It hurts good. Now, another thing you can do is you can come forward. I'll use my right shoulder as an example. I can work all of these muscles in the anterior shoulder as well. So I could get in here. I'm using my left arm to grab my right. I'm keeping my right arm totally relaxed, and I can sit here and I can roll this. Let me come out here more, and what I'm doing is I'm just bending my legs to roll that area. I was actually in the gym the other day and I was working out, and I felt kind of a cramping, almost like I strained muscle in here. But I knew at the point that I was working out, there's a good chance I hadn't strained anything yet. It was just the muscle binding up and cramping, which felt like a strain. So I took about 5 minutes. I went and I grabbed a foam roller. I go to 24-hour fitness like everybody else. Got up against the wall just like this, and I rolled it. And I totally got those muscles to calm down in the shoulder right here, and I went back to do my shoulder workout, and I felt no pain there at all. So a lot of times when you're feeling pain somewhere, you haven't injured the muscle yet. It's just starting to cramp up. I'm not saying you can never injure the muscle when you're on the weights. That's very possible, but most of the time the muscle is starting to cramp, and it's at that point that you just stop for a moment, go up against a wall, go on the floor, whatever it is, and roll, and you can get those muscles to calm down and go back to your workout and feel no problems, no pain at all. So this is just a great tool for working the shoulders and the neck. And yeah, that's all I got. My name is Dr. John Blenio. I'm with High Amplitude Health in San Mateo, California. I'm making this primarily for my patients, but hope to help anybody out who sees it. All right? Take care.